So we look at another complications in pregnancy. This is what is known as gestational diabetes. Gestational diabetes. Alright. Gestational. This is diabetes mellitus, but the woman is pregnant. Okay. So it's a type of diabetes that develops during pregnancy. Well, it could be that the woman had diabetes before pregnancy, okay, but it can also develop during pregnancy. So, but the one that typically develops during pregnancy, it typically disappears after pregnancy. It's just a complication of pregnancy, right? So it affects how your body processes glucose, leading to high sugar levels that can impact both your health and your baby's development. So what causes it? During pregnancy, the placenta produces hormones that interfere with insulin. Now, insulin is what is needed. See, insulin is needed to be released so that it can break down glucose, so that this glucose can release energy. Understand? So in type 1 diabetes mellitus, there's no insulin at all. In type 2, there's insulin, but the receptors on the cell is not responding to insulin. It's just like you are my friend, I come to your house and I say you don't know me anymore. That's type 2 diabetes, all right? So in pregnancy, some hormones are interfering with insulin, all right? So insulin is a hormone that regulates blood sugar. I've spoken about that. So if your body can't make enough insulin to overcome the resistance, then you have glucose freely going around in your system without anything to break it down. There's no insulin to break it down. That's resulting to gestational diabetes. So high risks, you are likely, like, what will make you develop gestational diabetes? You are likely to develop it if you are over 25 years old, you have a family history of diabetes. So these are the things that they'll be asking you in the hospital. Has anybody in your family complained about all of this? Yeah. If the woman is so fat, obese, right, you have gestational diabetes in your previous pregnancy, okay, then it affects some certain people more. South Asians, African Caribbeans, Middle Easterners, Symptoms is what? The woman has increased tests, alright? Why? Because she's urinating so much. So you are losing a lot of water. So there's a need for you to replace that water, The woman is weak, blood vision. So diagnosis is screening typically happens within 24 to 28 weeks of pregnancy using a glucose tolerance test. If diagnosed, your healthcare provider will help you manage it with what? Healthy diet. They'll now change, now tell you to stop eating this, eat this, Regular exercise, blood sugar monitoring, possibly insulin or other medications. So possible complication, if not managed, it can lead to what? You having a very big baby. That's macrosomia, premature birth, high blood pressure or preeclampsia. There's increased risks of type 2 diabetes later on in life. The mother can develop it or the child could develop it, right? So good news, with proper care, most women with gestational diabetes go on to have healthy pregnancies and babies. Blood sugar levels usually return to normal after delivery, but follow-up testing is important to monitor if it is now having a long-term complications on your health. So that's it for gestational diabetes mellitus.